African Medical Association says hospitals are with shortages of staff and equipment. Emergencies linked to high alcohol consumption will surge. The group says this annual pattern places additional strain on healthcare professionals who are already operating under difficult conditions, especially around this time of the year. Well, Summer Chairperson Dr. Mvuyisi Mzukwa joins us live for this conversation. It's very crucial. We've been checking in with some of our reporters, speaking to residents, and there's really a sense of joy that is happening. But the reality is often a lot of overburdening of healthcare facilities when it comes to alcohol-related incidents.
Good afternoon to you, Veronica, and your viewers, and thanks for inviting me, and Happy New Year to all South Africans, and especially the healthcare workers. The festive season is traditionally one of the most difficult periods in our facilities or in the hospitals. And alcohol-related harm significantly increase trauma cases, as you can imagine, medical emergencies, violent injuries as people tend to assault each other under the influence, and also it places enormous strain on the health, already overstretched facilities and services. But what you normally look or admissions, the majority of admissions will come from issues of road traffic accidents. They also come from assaults and interpersonal violence. You know, there's also what we call, Veronica, alcohol poisoning and burns. You just spoke to your colleagues around the beach. There's also drownings that are related to alcohol and falls, and many cases, as you can imagine, are entirely preventable. And in many emergency units, alcohol is the factor, in the majority of trauma cases we see over this period.
And can you give us perhaps an overview of the current pressures that hospitals are facing, and particularly which provinces are, under the most strain?
Provinces, as you can imagine, are really affected differently depending on which province you are. But also, some provinces would tailor their plans accordingly. For example, you'd have provinces like KwaZulu-Natal, provinces like Gauteng and the Western Cape being the mostly affected. But this trend cuts across provinces, especially those that are in the rural areas. You find that they will be mostly affected. Like, for example, if you look specifically at places like the Western Cape and Gauteng, there will be plans in place. For example, you'll find that along the major routes or major roads, there will be ambulances parked there, private and public, but also there will be emergency services that are waiting for any eventuality. So those are the plans that they tend to have, including air rescue, by the way.
And Doctor, we know already when we do the day-to-day news that shortages of staff and equipment is something that plagues health facilities every single day. But now, when you look at the festive season, particularly New Year's Day, we know that there will be an influx of emergencies. You outlined what some of those emergencies are, particularly at a time like this. But just talk to us about the realities of going to a healthcare facility at a time like this, where we know there is that severe shortage of staff, of equipment, but that influx of patients, the kind of challenges and perhaps maybe even at some times the chaos that happens in some of those facilities.
So what really happens is that, there are challenges that you may face at this point in time if you if you go to a healthcare facilities. Because what you can expect is that the emergency units, they tend to become overcrowded. So there's a longer waiting period because of the overcrowding. But also there are other issues that you may expect there. Because if you look at the ambulances, you may have a problem with delayed ambulances, or you may not find an ambulance because those ambulances are busy picking up people from different areas that have, are affected by alcohol-related injuries. But also there's exhaustion of healthcare workers. And the verbal and physical abuse that we tend to see at this time towards healthcare workers, and the moral stress when resources are stretched, they tend to affect how the speed of the service, but also the psychology of those healthcare workers during this period. And what also I wanted to highlight is that you are taking away services or from other emergencies. For example, you may have pregnant women that are coming in there. You've got children, you've got people with stroke, people with heart attacks, and those services will normally run normally if we are not engulfed by this period where alcohol is being abused. So the problem is dire at this point in time, and we wish we could have more to deal with these challenges.
And are there particular age groups on the radar for healthcare professionals when it comes to alcohol-related emergencies?
Well, the population tends to be younger, but what we have seen now, we are seeing a lot of women, females coming in, with alcohol-related injuries, and it's one of the complications, by the way, of abusing alcohol, where you find that people that the gender-based violence increases because of alcohol. So alcohol is part of the factors that are really driving the scourge of gender-based violence. So the younger generation, we usually see from the ages of 15. But you may have noted that even children are involved these days, because people tend to give alcohol to children, which is very, very dangerous and extremely, irresponsible to do so. So we caution everybody to really be very careful when dealing with such things as alcohol.
And perhaps maybe some advice to partygoers or residents as we head into just those final few days of festivity. What can they do to avoid a visit to the hospital?
Well, I think then we all need to plan ahead. We need to plan our journeys, but also we must avoid drinking and driving. We've got other options these days, Ubers and whatever you can call it, but we do have option. But also we need to do what they call drinking responsibly. You can't be taking lots of alcohol and then take a vehicle to the road. Otherwise, you're going to kill a lot of people there. So I think we should, as parents as well, model that moral behavior, especially in front of our children, and show them the way that when we move forward as a country, we can be exemplary as parents in those issues. So I do believe that we can avoid this by being responsible with the use of alcohol.
Right, thank you very much. An important conversation, and also the realities of some of the healthcare facilities that are already burdened and having to deal with some of those alcohol-related emergency. That was, of course, Summer Chairperson Dr. Mvuyisi Mzokwa joining us there for that conversation. All right.